everybody. This is Jim with Compliance Professionals here to give you a good safety talk. We're going to talk about bloodborne pathogens today. It's important to keep yourself safe in the workplace. That includes assisting other individuals who may have been injured. You may come across blood or other bodily fluids when there's an accident at work and somebody gets hurt badly. You have an increased chance of being exposed to a bloodborne pathogen at that time. So a pathogen is a specific cause of disease, like virus or bacteria, and then bloodborne means it's carried by our blood. It's also possible to contract some bloodborne pathogens through other bodily fluids. So let's first of all talk about different types of bloodborne pathogens. Number one, HIV and AIDS. HIV leads to AIDS. HIV attacks and depletes the human immune system. Early symptoms resemble the flu virus. HIV does not survive outside the body, and there's no known cure for HIV or AIDS. The second one that we have to be worried about would be hepatitis B. 1.4 million people are infected in the United States with hepatitis B. It can lead to chronic liver disease, cancer, and many times death. Symptoms include general fatigue, abdominal pain, no appetite, nausea, and vomiting. A vaccine is available and very helpful. Hepatitis C is the most common bloodborne infection. 3.2 million people in the United States are infected with hepatitis C. It can lead to chronic liver disease, cancer, and then also death. The symptoms can take years to manifest. Once again, they also include flu-like symptoms, dark urine, fatigue, loss of appetite, nausea, vomiting, and abdominal pain. And the treatment is just marginally effective. I want to show you a demonstration right here. If I take one drop, and let's just pretend, this is water right here, everyone, but let's just pretend it's HIV, okay? If I take one drop, place it there, and then I take another drop, and let's pretend it's hepatitis B over here. Okay. By the time my sentence was finished, the HIV particles are dead. And there were approximately 3 or 4 HIV particles in this drop of fluid. They've died by now. If we compare it to hepatitis B, there's about 1 million particles of hepatitis B in that drop that I placed right here on the clipboard, and it'll be alive 10 days from now. Which means if you had a cut on your hand and you ran it across this clipboard 10 days from now, there would be a chance that you could get hepatitis B. So you can see why everybody's very concerned not only about HIV, but even especially hepatitis B. Got to keep things clean, got to keep your hands clean and washed. Let's talk about it just a little bit further. Some of the routes of exposure. How do people get this anyway? Well, it includes contaminated sharp objects, needles, broken skin, rashes that people have, sores in their eyes or nose or in their mouth. And then, because it's so easy to become contaminated, if you are exposed, it's important that you wear the proper personal protective gear. If you are assisting somebody and you're trying to keep yourself safe at the same time. So protecting yourself is of the utmost importance. When exposed to blood or other bodily fluids, it's important to wear the proper protection. That would include gloves, masks, eye protection, and other protective clothing. When cleaning up bodily fluids, you might want to wear your PPE also. And you should always use a 10-to-1 ratio of water to bleach to kill any blood that may be on the floor if somebody's been injured. And then once again, wear all of your protective gear. You should have available something like this. This is a biohazard spill kit. Sometimes it's called a bloodborne pathogen kit. This contains several items. I want to make sure everybody sees this. It contains one pair of disposable gloves, one red biohazard waste bag, one pickup scoop with a scraper, one fluid control solidifier package, one microbial hand wipe, a twist tie, cleaning disinfectant wipes, disposable dry absorbent towels. You need to go get something like this, and obviously on site they have these. Everybody has them. So if somebody does get hurt, when it comes time to cleaning things up, this is what you go get, all right? Use the fluid, 10 parts water to 1 part bleach. Immerse the whole area with that fluid before you start cleaning up, and then use lots and lots of water. Everything should be put in the red bag and then disposed of, okay? So if you're helping somebody else, let's say somebody else really got hurt and you're on the job site, there's a few things that we need to do. Number one, check the area for hazards before responding. If there's been an accident, you need to make sure you look around before you just run over and try and help somebody. There could be something very dangerous and you could get hurt. Treat all bodily fluids as if they're infectious. Wear disposable gloves, face shields, masks, aprons, any barrier that you can find to protect yourself while you're helping that individual or when you're cleaning up. If it's possible, if somebody's been cut and hurt badly, if they can bandage themselves up, if they can bandage their own wounds, that would be good. Don't pick up sharp objects with your hands. Maybe there's some broken glass around or something of that nature. Don't try and gather that up with your hands, okay? And then make sure you're wearing protective gloves. Clean and disinfect the entire area with the solution that I talked about. 10 parts water, 1 part bleach. That'll kill it. Remove your gloves and other protective equipment in a manner that prevents exposure. When you're done cleaning up the area, place all of it in the red sack. Place all contaminated items once again into maybe a metal container that will be disposed of, or any other bag that you may have that's going to be disposed of. Thoroughly wash any part of your body that may have been exposed to bodily fluids with soap and water, and then report that exposure of contact that you may have had with potentially infectious bodily fluids to your employer, right? We want to make sure that there's medical follow-up that takes place. So, hand washing. Hand washing is so important these days. We've been talking about it for months now with COVID, but especially if we've got bloodborne pathogens that we're working with. I want to talk to you a little bit about hand washing. It's been shown to be one of the most effective ways to keep ourselves clean and from catching anything that we may be around. So, use a disposable paper towel to turn on the sink faucet. Thoroughly wet your hands with water and apply a generous amount of soap. Rub your hands together, guys, covering all surface areas. The backs of your hands, your fingers, underneath your fingernails, the palms of your hands, and you should do this for at least 20 seconds with the soap. Then after that, you should thoroughly rinse your hands and rinse them for another 20 seconds. Then dry your hands with a disposable paper towel and then use that towel to turn off the sink faucet. So, what if you don't have a faucet around? What if you're not around a sink? Hey, if you have any hand sanitizer, it's not quite as good as water, believe it or not, but it will work. Fill the palm of your hand with hand sanitizer. Make sure that you have enough to apply a generous layer to both of your hands. It should be at least 60% alcohol. Spread it around the palms, the top of your hands, your fingers, underneath your nails. Once again, get up underneath the cuticles if it's at all possible. Don't ignore your wrist areas, and make sure those have been sanitized with hand sanitizer. And then continue to massage that hand sanitizer into your hands for about 20 to 30 seconds. Please be careful in regards to bloodborne pathogens. They can harm you and they can destroy your life. I know an individual that has hepatitis B. It's day to day for him. He can no longer work, and he's just in terrible condition. Be careful in regards to all of the ails that are out there in regards to bloodborne pathogens. Okay, we've got a quiz, bloodborne pathogens quiz, that we need to go over. The first question is number 1. What are 3 bloodborne pathogens we need to be most concerned about? It would be A, B, and C, HIV, hepatitis B, and hepatitis C. Number 2, how can I get a bloodborne pathogen from somebody else? It's C and D. Contact from someone else's infected blood or contact from someone else's saliva that has infected blood. What do I need to know about, this is number 3, what do I need to know about protecting myself from bloodborne pathogens? Which one of these is false? It's B, protective gloves won't work if the person can still breathe on you. Well, that's false. Breathing doesn't count when it comes to bloodborne pathogens. And then number 4, true or false? We should treat all human blood and other bodily fluids as if they're infectious and isolate ourselves from it through protective barriers. Absolutely 100% true. Hope you had a wonderful holiday season. Happy New Year to everybody, and thanks very much. I'll talk to you next month. Take care.